So, what if I told you there's a really simple but incredibly powerful tool that can totally transform the patient experience? I'm talking about boosting satisfaction scores and really creating a culture of excellence in your healthcare organization. Well, it's called leadership rounding, and in this explainer, we are going to break down exactly how to master it. Let's dive right in.
Here's a quick look at our game plan. First, we're going to dig into why the patient experience is so incredibly important. Then, we'll talk about the new mindset that's required to make a real difference. After that, we'll get into the practical side of rounding, cover some specific scripts you can use right away, and finally, wrap up with the most important part, how to turn all those conversations into real, tangible action.
All right, let's start with the absolute heart of the matter, what it really feels like to be a patient.
You know, it's kind of fascinating. The word patient actually comes from a Latin word that means to suffer. Now, that isn't just a fun fact for trivia night, it's our mission statement. Our job, at its core, is to lessen that suffering.
So that's the big question, right? How do we take that experience of suffering and turn it into one of satisfaction? Well, the answer is surprisingly simple. We have to listen. By systematically gathering direct feedback, the kind of invaluable insights that show up in things like the Survey of Healthcare Experiences of Patients, or SHEP scores, we get the data we need to drive real improvements. And leadership rounding? That's the engine that makes it all happen.
But look, to truly make an impact, it takes a lot more than just a new process. It really requires a whole new way of thinking.
For the longest time, that old Latin root kind of implied a passive role for the patient, someone who just quietly took whatever care was given. But modern healthcare is all about flipping that script. This really shows the shift perfectly. We're moving away from seeing a patient as a passive recipient and towards seeing them as an active partner who's empowered and totally involved in their own health journey.
So how do we make this cultural shift actually happen? Well, it boils down to 3 steps. First, we have to think differently, really putting the patient experience front and center. Then, we plan differently, setting clear, measurable goals. And finally, we have to act differently, making those patient-centered choices every single day.
Okay, let's move on and see how this all builds into the actual practice of rounding itself. This is really where the theory gets put into action.
I absolutely love this quote because it just nails what leadership rounding is all about. It's not about just being friendly or making small talk. It's strategic. It's about getting out from behind the desk, getting onto the floor, and gathering the kind of insights that are going to make a true difference.
So what does high-quality rounding look like in the real world? It's about making that patient feel like they're the only person that matters in that moment. Put your phone away, make eye contact. It's about addressing their needs right then and there, not just adding it to a to-do list, but maybe grabbing that extra pillow yourself. It's about reviewing the care plan together, like a team, and doing it all with a positive, respectful attitude.
And here is a super simple but unbelievably powerful technique. Sit down. Seriously, when you sit down at eye level with the patient, you completely change the dynamic. It breaks down that hierarchy, it shows respect, and it sends a clear signal that you're there to spend real, meaningful time with them, not just rushing through a checklist. It's such a small action with a huge impact.
Okay, so you're there, you're sitting at eye level. Now, what do you actually say? Knowing what to say can make all the difference. Let's look at some really practical scripts that can help guide these important conversations.
You know, the opening sets the tone for everything that follows. This script is just perfect because it introduces you, it clearly states your purpose to ensure they get excellent care, and then it asks this big open-ended question that just invites the patient to share whatever's on their mind.
On day 1, your focus should be on establishing the fundamentals. Are they comfortable? Are they able to rest? Do they feel respected? And, maybe most importantly, do they feel like they're being included in decisions about their own care? These questions really build the foundation for their entire stay.
As their stay goes on, the questions start to evolve a little. You check in on communication, and then you introduce this game-changing question. We want your care to be a 10 out of 10. How would you rate it so far? This gives you a really clear metric, and if that score is anything less than a 9, it's an immediate opening to ask, what can we do to make your stay better?
Finally, at discharge, the focus totally shifts to making sure they have a safe transition home. Do they understand their instructions? Do they know exactly who to call if something comes up? This makes sure they leave feeling confident and cared for, right up to the very end. And of course, you ask for that final rating, giving you one last chance to understand their complete experience.
All right, now for what might be the single most critical part of this entire process. You see, the conversation is only the beginning. The real magic happens when you turn that feedback into action.
This is where the rubber really meets the road.
Closing the loop means turning all that talk into real change. First, you spot the themes. Are lots of patients mentioning noise at night? Then you prioritize. A safety concern is obviously going to trump a comfort issue. Most importantly, you follow up. Let patients and staff know you heard them and you're taking action. That builds incredible trust. It's also your chance to acknowledge your star performers and find coaching opportunities to lift up the whole team.
And let's be crystal clear about the goal here. This isn't just about managing complaints or putting out fires. The goal is excellence. It's about proactively aiming for a perfect score in the patient's eyes, a true 10 out of 10 experience, every single time.
And this brings us right back to where we started. Every script, every conversation, every single action we take, it's all in service of this core mission, to lessen the suffering of our patients by providing the best, safest, and most compassionate care we possibly can. So, what's your next step? I want to challenge you to have one conversation today that puts these ideas into practice. Maybe it's just sitting down at eye level with a patient for an extra 5 minutes. Or maybe it's asking a colleague how you can better support them. Whatever it is, start small and start today.